what age does andropause happen?
It also depends. It could be like late 40s, could be in their 50s. And I see a lot of men these days as early as late 30s and, early
Again,
40s.
due to the stress.
Again, due to just stress. They do have, things like erectile dysfunction. They are depressed. So a lot. And I see a lot of them, for men, I guess, they need to know that it's okay, to come out and to seek help. And so it's going through the similar process, the clinical symptoms, and then examination, doing, the blood tests for them and helping them in whichever department, in whichever, areas that they require. So to answer your question, yes, they also do go through andropause. It's just that their symptoms are more gradual as compared to women.
Optimum hormone levels is key to good health. In this episode, we talk about wellness vis-a-vis maintaining good, healthy hormone levels for the body, mind, and soul. To talk about that, we have Dr. Sangeet, a medical doctor specializing in integrative medicine. Dr. Sangeet is also the founder and director of Eagle Pharma and Freya Wellness, which compounds medicine specifically tailored to individual needs. She is a qualified and certified practitioner in Bioidentical hormone restoration therapy and a certified practitioner in nutritional medicine. Dr. Sangeet, welcome to Ask the Boss. Can you tell us more about your specialty and your integrative medicine?
Yeah. Firstly, thank you so much, Nick, Sarina, and Fasi for having me today. And okay, so I guess when you talk about integrative medicine, so a lot of them, they ask, what is integrative medicine? So it's a term that is used to refer to medical practices that is not conventionally used in our mainstream. So for example, we look into nutritional medicine, we look into hormonal balancing, where you just mentioned bioidentical hormone restoration therapy. That's what I do. We look into lifestyle, we look into diet. So basically, it's addressing the root cause of any illnesses.
So for example, if someone were to come to you and complain that they have recurrent sinus issues, so how would you tackle that?
Okay, so firstly, I will go into their diet. Now, I think it's important to also know, I always educate my patient to say that, all healing begins from the gut. So I will actually go into detail of what they have for their breakfast, their lunch, and their dinner. So for example, when you talk about sinusitis, there's inflammation that's happening in the sinuses, there's congestion. So what actually triggers that? So based on research and my personal experience, whether it's, recurrent sinusitis, eczema, asthma, or any skin conditions, then we will actually eliminate. So I will practice the elimination diet. I will start with the dairy products. So because based on nutrition, what we have studied, it's like, when you take a particular dairy. So for example, some of them will say, doc, I just don't take a lot of dairy products. When I just have a little bit of coffee, sedikit sahaja. But that small amount will actually trigger the mechanism. It's like a switch on and switch off. So the antibody will actually get triggered. And when we eliminate, we will say you have to eliminate it 100%. For at least 2 to 3 weeks and see the difference. And if a person feels better, they don't fall sick, all this recurrent sinusitis, so you know that you are addressing what triggers your immune system.
Does exercise also plays important role in your treatment?
I always talk about the 5 pillars of health because exercise is very important, right? So exercise is something that, when you exercise, everybody feels good. Right? I mean, I think for your own experience as well.
Yes.
Right? Because it produces endorphins, and endorphins is something that, you don't have any supplements to pop in. It's just naturally produced by our body. And, when you talk about the 5 pillars, I always, advocate on, gut health, your vitamins, your minerals, your stress levels. What do you do to address your stress, your exercise, and your hormonal balancing.
So where do you start? You mentioned dairy product.
Yeah.
So do you start with the diet first, then go into gut and hormones? What is the order, so to speak?
So depending on the clinical symptoms, so if you were to say sinusitis, so I already know that it's starting from basically the diet. So I will address the diet, which is also the gut. But I will, of course, I will give them some clinical symptoms to help to ease the sinusitis. You know, we've got the nasal spray, we've got all the antihistamine. So I do what is actually practiced in conventional allopathic, where we'll give all the, you know, that steroid nasal spray where it helps to reduce the congestion so a person can sleep better, they feel more at ease, but at the same time addressing the root cause so that they don't get that recurrent sinusitis. Yeah.
Okay. So what are the symptoms when you feel that you're not well? What are the symptoms usually that occur in people when they are having some hormone imbalance problems?
Okay, so hormonal imbalance, let's talk about women. It's a lot. It's vast. So it could be as simple as PMS, you know, where we have all the mood swings, the headache, you know, the severe cramps, dysmenorrhea. So that can even happen with our daughters, right? You know, in our teenagers, as simple as PMS, you know, and also it could be anything from polycystic ovarian PCOS. So they have that weight issues. So all this, it contributes that we know we are addressing hormonal imbalances. And then, of course, perimenopausal women, menopause, perimenopause, it could be anxiety, insomnia, weight gain, mood fluctuations, you know, decreased libido.
Right. So when we talk about hormonal imbalance, what do you do that is different from a conventional doctor, a conventional medicine? So if there is this person who maybe suffers from a lot of mood swings, how does she decide, oh, do I go to a conventional doctor or do I go to a doctor that practices integrative medicine?
See, the thing is with integrative, we go into in-depth, right? So if a person were to come to me, then, you know, we'll go into the in-depth of, you know, understanding the clinical symptoms, when it occurs, is it related to, you know, the menstrual cycle. So it's actually, so the consultation may take about an hour. So after the consultation, physical examination, we do a thorough blood investigation. So the blood investigation is more in-depth than the normal GP clinic because we go beyond the baseline. You know, we just don't do, you know, the full blood count, the kidney function, liver function, cholesterol, you know, all those we look into. I would go into the vitamin D because that governs immune system, homocysteine, which tells, you know, whether a person, you know, is at risk of heart disease and so on and so forth. And I will look into the hormones.
So you will start with blood tests.
We'll start with that from there. From the consultations, examination, then I will decide what sort of hormones to do. So if a person is already heading towards perimenopause, menopause, then of course the hormonal test will be more in-depth. But if a person is in their 30s, and it could just probably be maybe, you know, thyroid symptoms, right? Whether it's chronic constipation, weight gain, you know, they have all the brain fog. Early morning, they feel very difficult to wake up from bed or feel less rest.
Yeah.
And also adrenal. So a lot of us, we tend to be adrenal. So the thyroid and the adrenal, they are linked. So if a person has those two, I will just zoom into those.
What is adrenals again?
Sorry. Adrenals is, you know, it's a gland that sits on the kidney, and the hormones that actually governs the adrenal is like cortisol. So cortisol is our fight and flight, right? So we don't want it to be too high. That means you're too stressed, or you don't want it to be too low, which probably will lead you to fatigue. So cortisol has got a circadian rhythm. Like why we wake up in the morning, because our cortisol is up, so that, you know, we are all up and about, and then towards the evening, gradually it will decrease. So our melatonin goes up, and then, you know, we are able to rest and sleep. So sometimes, you know, if a person who is not sleeping enough, or they are more towards the night shift, so they wake up, you know, they're working throughout the night, and then everything gets disrupted. So their circadian rhythm gets disrupted, and everything goes haywire. So that's when, you know, their cortisol level is like high during the night, and then lowers in the morning. So a lot of us tend to, you know, struggle with that, especially doctors and, you know, those who work long hours.
So those who do not work proper hours, like they work maybe late into the night. So they will have to have like an intervention to their cortisol levels. Is that what you're saying? Rather than let the own body adjust to it? Or is it, is the body able to adjust to it on its own, or you definitely need some help?
I think over time, the body will somewhat sort of, adjust, but majority of them, including myself, my personal health journey, I was one of those. So my whole circadian rhythm was disrupted. I had, adrenal fatigue, which was a burnout. And of course, I had underactive thyroid as well. So I needed intervention. So the other hormone that besides the cortisol is actually DHEA. So it's a balance between the cortisol and DHEA. So for me, it was addressing, what was deficient, because my cortisol levels were very low, my DHEA was super low, my thyroid was low. So it's optimizing those, but also, looking into the sleep. So I, of course, from one department, you got to move to the other. So you don't work that long hours, because I realized that, my heart health is a priority. So I got, into more like working towards the day rather than working at night, and then got into, yoga, meditation, something to help me overall to, to recover from all the adrenal burnout and also to manage my stress levels.
And how this treatment will last? Do I have to take it for the whole of my life, or until certain period to, balance again the hormone level?
Yeah, I guess, it depends which hormones you're on. So if let's say you're talking about adrenals, and then you're talking about thyroid. So personally, thyroid, I feel in my experience, including myself, I've tried to go off, the symptoms will come back. So if you're talking about BHRT on perimenopausal women, so menopause, it's a whole different, regime, because menopause is when, our body, we cease to have all our menstrual cycle for a year. So our hormones are depleted, right? That is part and parcel of life. So the best time to take it is actually within the first 5. The sooner, the better. And the reason is because, we want to protect our heart. We want to protect, from our brains, all the stability. Yeah. So, you can go on it. And then when you feel that, you just, at least for about, it depends, it's an individual, right? Whether it's 2 years, whether it's 5 years, you want to stop, you can stop. And then, just see how it goes.
So you're saying it's best to take this medication. Is it right to say medication?
You're talking about hormones.
Hormones,
right?
yeah. It's for menopausal women.
Yes.
Within the first 5 years.
The earlier, the better.
The earlier, the better. Pre-menopause?
Okay, so when you're talking about perimenopause, it depends what symptoms you have. So, for example, so this is once when we are like 35 and above, for women, the first hormone that actually, decreases is actually our progesterone. So a lot of the symptoms, whether it's, insomnia, anxiety, mood swing, our progesterone level tends to dip more rapidly compared to the estrogen. So majority of the time, you may only need, progesterone replacement.
Yeah.
Yeah. So when I say, replacement, it may not be like every day. It could just be, according to your cycle, maybe 10 days, maybe 12 days, depending on individual. So the whole thing about, this BHRT is very personalized. It's very targeted towards an individual. There's no one size that fits all. So Sarina, for example, if you were you were to come to me and I were to do a full blood profile for you, I will walk through, first of all, your clinical symptoms, examination. We do the comprehensive blood test, and then I'll tell you, okay, this is what it's suboptimal or it's deficient. This is what you need. And then I will put you on it and I'll explain, how many times you need to take it, whether it's related to your cycle or just a certain days in a week. And then we'll monitor and I'll see you back, maybe less than 3 months just to see how you're doing. And then we will probably repeat the blood test as well to see not the whole profile, but those that is needed that was deficient.
Right.
So monitoring.
Yeah. So above 35, the progesterone level goes down.
Majority. Because it's part and parcel of, whether you call it physiological aging, stress. So stress, as we know, it's the root of all evil. A lot of people, they have all this hormonal balance due to stress, due to lifestyle. and of course the diet.
So between the ages of say 20 to 35, is it like you can just relax and just let your body take its course, and you don't have to worry about it, and just maybe see you after 35?
Yes, I mean, look, what I would always educate for the young ones, just lead a healthy lifestyle. Make sure you have adequate sleep, because the youngsters these days, they sleep the wee hours 2 to 3, and we know that the body it sort of like rejuvenates and recuperates, recovers. Healing begins from 11 p.m. to 3 a.m. in the morning.
Right.
So that's when the growth hormone, everything optimizes. So imagine what happens if a person sleeps at 2 a.m. So these are the people that they're going to have a lot of issues.
Right. You're a doctor. I'm sure you slept like wee hours in the morning when I was preparing for your exams.
No choice. Difficult.
So all that will, even for a young doctor, that will affect their hormone levels. Notwithstanding they're still young, say if they're 24.
Especially the adrenals, the cortisol, when the adrenals will be impacted, no doubt about that.
So it really depends on the lifestyle. How
it boils down to that. Yes.
How stressed you are. Okay.
So I think the stress management, what do you do? I always ask a person, how do you cope with your stress? Because stress is inevitable. Everybody goes through that. What do you do to cope with your stress? Right? So it could be anything. For individual, it could be everybody, it's different. For some, it's yoga. For some, it's meditation. For some, it's hitting the gym. It could be all.
True.
Journaling.
So you could be stressed just looking at your cat having a tummy ache or something. It can manifest itself. Through all sorts of things. Not necessarily work.
So what about for men? I mean, do they have to go through this kind of treatment as well? Do you think
it's a very interesting question?
It's important for them to have a look at their own, problems, internal problems? So especially when they are married, right, with a couple, so they need to go through this together.
So this is a very interesting question you ask, because everybody thinks that menopause is something that only women go through, but in reality, the reality check that even men go through similar. So what we call it as andropause. So we refer that to the male menopause.
What age does andropause happen?
It also depends. It could be like late 40s, could be in their 50s. And I see a lot of men these days as early as late 30s and, early
again
40s.
Due to the stress.
Again, due to the stress. They do have, things like erectile dysfunction. They are depressed. So a lot. And I see a lot of them, for men, I guess, they need to know that it's okay, to come out and to seek help. And so it's going through the similar process, the clinical symptoms, and then examination, doing, the blood tests for them, and helping them in whichever department, in whichever, areas that they require. So to answer your question, yes, they also do go through andropause. It's just that their symptoms are more gradual as compared to women. I think women, we are more drastic when our pictures us. Because men, even they could still have the testosterone levels, right? But it just gradually it decreases. So their symptoms are a little bit more gradual, not as drastic as women.
Interesting. Good to know.
And to answer your question, about the libido as well, as couples, and I think would be great, if as couple, when especially the libido is concerned, when they come in together. Because if one comes in and they say, look, my libido is very low, I want to address it. And you optimize their libido, their sex drive. And if their partner has got very low libido, so how does that, help in the couple, in their bedroom life? So something to think about, it'll be great if they could come together.
We always hear about menopause, but you don't really hear about andropause. It's not really talked about much.
Maybe we should do in our next session. It's
something to do with men's ego as well, I guess.
Yes, so that is one, because I guess a lot of them, they don't come forward and get help. But then again, it depends whether it's the Asian man or Caucasian, because Caucasian, they will come up and they will talk about it openly. So I've got some of them, they're fine, because for them, they just want to have quality life, be it whether it's their libido, whether it's, in the professional life, they just want...
Also for the energy level, right?
Of course, when it comes to professional life, the ability to make decision, to be optimum health,
Good sleep.
yes, everything.
When we talk about hormones, testosterone specifically,
Yes.
Even ladies, women, we have testosterone.
Yes. For women, testosterone, like even though it's a male hormone, we do require it. It's a small amount, right? It is like, what we call it as androgen, a male hormone. Similarly, men, they require a certain amount of estrogen as well, but a small amount. Okay, so women, now the testosterone, it goes beyond the libido, right? So it helps in when you talk about mental clarity, the ability to, make a certain decisions, and when you talk about our bone health, right? So when you talk about the bone density, it helps to maintain. And when you talk about muscles, when we go to the gym, we want to build, not to say like huge amount of bulk muscles, but as we go through perimenopause, menopause, we lose a lot of muscles, right? 3 to 8%. And as we age, we lose a lot more. So testosterone, it just helps overall in clarity, to help in, our libido, to build our muscle and our bone health. And, a lot of type A personality, like we call it the lady boss. Before they go into a certain, sometimes it's like important meeting, right? When they want to chat, they actually do apply a small amount. When I say a small amount, you don't need more than 5 milligram, maybe just a 2 milligram. And it helps. So we prefer doing the transdermal because it bypasses the liver. Similarly, when it comes to estrogen, we don't take it orally because we don't want, it's safer. So when you talk about bioidentical, it's safe when you balance the estrogen, the progesterone, and of course, when you talk about testosterone and the estrogen, we do it through the transdermal, where it bypasses the liver. It's always, firstly safer, first do no harm. So I truly believe in that.
Bioidentical. So basically, it's identical to the biology of the body?
Yes. So the hormones that we use has got a similar chemical structure. When you compare it, it's similar to what is produced in our body. Yeah. And it's derived from soy and yam. So it's actually safer. But then there again, when I talk about safe, it's always good to go to a practitioner who is certified and trained in this field, because when we give, like physiological dosages. We don't give high dosage. What are the rules, the do's and the don'ts. So all those matters.
And you compound this medication via Eagle Pharma, right? It's not like it's tailored specific to your patient's needs,
Individual needs.
Yeah, as opposed to going to a pharmacy and just buying vitamin D, vitamin B, whatever 12, and all sorts of vitamin B. But so you actually compound it to make sure that it is what your patient needs.
Yes. Yeah. So remember I told you when a patient would have come to me, we'll do, that thorough examination, clinical history. And then when we do the blood profile, it's an investigative. So when the report comes back, I will sit through and I will discuss with them what the body requires. So it's very tailor-made. It's very specific.
Yes.
It requires prescription. So you don't get this in a retail pharmacy. So a lot of them, they don't quite understand the concept between retail and compounding. It comes under two different, when you talk about regulations. So compounding is also regulated by KKM, and it just comes under a different umbrella. We don't have that MOH, they have the KKM hologram and stuff because it is not registered per se. Registered products comes under retail pharmacy where it's all one dose, whereas compounding, its prescription is what is required, patient's details. Yeah. And very tailored.
Yeah, very tailored, which is much better than you just, go out there and buy any vitamins off the right?
It's really,
it's meant for you.
Yes. Yeah. I believe every individual, they need to look into what their body requires. Because I've got a lot of patients when they come to me, when they put all their supplements on the table, this is what I take. So many. So I said, okay.
Is it harmful when you take too many of them and not sure that it's really good for you, for the body?
You know what? It's always good to do a blood test to find out what your body requires. If you're taking all this, and then if I were to check your vitamin D levels, your homocysteine levels, I will know whether are you absorbing those, right? And if you're not absorbing, let's address your gut health. And, sometimes it's just not enough what they're taking because, the doses are very low. So that's when I find that when you do your blood profile, we just need to address what you require. And when you compound in that one particular capsule, I can give you a 10,000, let's say, for example, if you're deficient in vitamin D, 10,000 IU of vitamin D, and then, you can add on the zinc, the selenium all in one capsule. It avoids polypharmacy. You don't have to take too many. And then, we'll repeat your profile in about 3 months. And if you've fully reached the optimum level, let's maintain with 5,000 IU. Just to give you an example. Yeah.
So I suppose taking too many supplements is also taxing on the liver.
Yes.
So you are probably unnecessarily taxing the liver by taking all the supplements that you may not need.
Right?
Yep.
Yeah.
So that's when, it's always good to do a blood profile just to see what you're taking. Is it adequate? Is it you need more? How many milligrams do you need? What is the dose? And this is when I truly believe in, personalized supplements.
Yeah, but you were saying just now you do your blood test every 3 months. So do you have to repeat like in a year, 12 months? So do you have to do like 4-time blood tests just to check that you are
No.
good with your hormone level?
No. So it's basically, let's say if a person is menopause, when we're giving them the hormonal restoration, the BHRT, then obviously I need to know, when you come back just before the 3 months, are you getting enough, how you feel clinically. So the other thing I need to, to reinforce is we don't always treat the lab tests. I need to know how you're doing clinically because sometimes the lab test, it's like a snapshot. It's what is in the blood. It's not really necessary what's in cellular levels. Right? So sometimes we need to do the urine test, but of course, the cost is a bit more. So for some, depending if they don't want to spend too much, I need to know how you're feeling clinically, and as I mentioned, when we start with low dose, it's all physiological dosages. And to answer your question, Fuzzy, maybe it's like in 3 months, if let's say you're doing great, then maybe 6 monthly. And if you're fine, then annually. So you don't have to come every 3 months and spend a lot of money doing, monitoring. No, that is only very few cases. Some, generally I would say about 90%, they're very straightforward, but there are some cases, where it might be a little bit more complicated. So those are, the clients where I really probably need to think outside the box and, to look into other modalities. What else, that we need to check? Then maybe we need to do a bit of, whether, depending where we are targeting, right? Whether we need to do the urine test, whether we need to look into other things, other aspects.
It's a form of preventive medicine also, isn't it? Because by regulating your hormones, you potentially could avoid complications later on in life.
Yeah.
Like for example, a person who has too much estrogen, you'll probably you'll bring it, with via your medication, you can try to bring it down and potentially avoid complications from high estrogen later on in life.
Yes. Yeah. So when we talk about, I think the term we said is the xenoestrogens, where, these days we see a lot of, children, girls, Menarche used to be at 12 years. That is quite an average. But these days you see as early as 9 years, 10 years, because just too much of environmental estrogen. Right. So we need to look into all those. So, maybe we can talk on another topic on microplastics. Where's all this estrogens coming from? It's all from our environment. Then that leads to, estrogen dominance, which cause absolute, hormonal havoc, especially for women. Be it polycystic, dysmenorrhea, you have all those, fibroids, endometriosis, a lot.
And it's all from microplastics.
A lot of it is created by, environment. And then, some, if you talk about the body naturally produces, because I mentioned once when you're 35 and above, through the aging process, progesterone decreases faster than the others, right? Other hormones. So it's one of the early hormones which naturally will actually make a person more estrogen dominant. So we have to look into the environment as well. Got to look into the food.
And also, you mentioned to me not long ago about the perfume. You were saying to me that do not spray the perfume right to your skin, but more on the your clothes. Why is that so? I mean, does it have to do with the estrogen as well?
Yes, so that's all part of, when you talk
Yeah,
about
ever since I started doing that, and I started flying up when I'm already.
Yeah. So you talk about, the plastic bottles and, sometimes when we go and tap our food, what do they do? Hot food, they put directly into the plastics. So of course, all this chemical, it leaches into the food, right? And then you talk about, the pesticides, all our fruits and vegetables where it's, flown from Australia, everywhere, because you have to, prolong their shelf life. How do they do that? So it has to be a lot of chemicals that's added to, the preservatives. So as much as you can, eat local food, support the local industry, and as much as organic as possible, take your, your glass, when you want to go and tapao, give it to them to actually, to put it into it, and then avoid all this, how much of makeup that you use, what's in it, where is it derived from, perfumes. So this is actually all in our environment.
Yeah.
We cannot control the pollution. It's all in our pollution as well.
Sometimes it's difficult also. Like for the other day, I wanted to tapao some hot tofu farm, and I actually brought a glass bowl for the seller to put the hot tofu farm into the glass bowl, and she made a bit of a fuss because she says, "No, that's my measurement is going to go awry with this glass bowl. I have to put it in my plastic container." I was like, "No plastic container, my glass bowl." So that was a bit of a problem because people out there they're not used to people coming with their own containers. But I suppose it's over time, we have to just educate society.
It's like awareness.
We want to protect our environment. We got to go green. We got to make all these changes. So even if it just takes that one step, like what you did, just fantastic. That one step at a time. Yes, that's how we create the awareness. So for them, they'll be like, okay, this is something new for that lady. But she will be surprised the next person comes, and she will get used to it. Used to it, and she knows that she probably needs to know. Okay, probably get a glass measure, whatever container measurement to put it into there to measure to be able to transfer into your.
I think it's a matter of mindset. Not that she don't know the dose. I'm sure she knows. Just that she don't want to change her routine.
So that's
used to it.
Her SOP.
Yes,
her SOP is to use the plastic container.
She present it,
Absolutely, because change is always
difficult.
So nobody is, that open to changes. It's very uncomfortable, but it's just a matter of practice and taking that first step.
Yeah. What you mentioned about girls having high estrogen levels. So you mentioned what, xenoestrogen?
Yes.
Yeah. So at a young age, that's probably due to food and all this chicken that's been injected by all sorts of antibiotics.
Yeah.
That's very worrying.
It is because there again, it's all in our environment. So I think, it's the choices that we make. So maybe perhaps go for all that ayam kampung because, I still remember once when I went to the market, I was just looking at the chicken. I'm like, man, why is this chicken is huge? You look to the ayam kampung, it's like so scrawny. It's quite scary. It's like, what are they doing to it, right? One is it fat, one have they injected. And of course, naturally, I would go for, the ayam kampung just to be on the safe side.
It's absolutely, It's scary now. The other day I was at a function and I saw these grapes. They were like a perfect circle round.
It looks like pink, right?
It looks so how are these grapes? I've never seen grapes like so round because they're usually oval. But this is round and I was like, there's something wrong there. I'm not going to eat those grapes. It's just...
So you're quite intuitive. Sometimes, you just follow your intuition, right?
Yeah. When something doesn't look normal, just avoid it totally. True. So microplastics, I mean, that's a big thing. I mean, the other day I was watching this documentary on Netflix about plastics. It's crazy how much plastics there is in our oceans. It's everywhere.
Absolutely. Absolutely.
So, it's scary how much microplastics we are ingesting without knowing. That's also the big worry. So I suppose if you go to the root cause, nutrition,
yes,
then hormone therapy,
yes,
the gut health,
right? Address, if you have inflammation, you check a certain parameters, like CRP, high HS, high sensitive CRP. Where's the inflammation coming from?
What is CRP?
It's one of those inflammatory marker. So CRP stands for C-reactive protein. So sometimes when a person comes to you, whether they're in pain or they may not even have, the silent, what we call it as a silent killer, they don't have any clinical symptoms of any aches and pains, because aches and pains is always something acute, right? We can identify if you have a fall, you have a swelling, we can address that. But what about those who don't have, any clinical symptoms and you check, oh my God, their CRP is like 20s higher. So where is the inflammation coming from? So it's always good to address from the gut. So all healing begins from the gut. So don't forget when we talk about mental health, right? So, the neurotransmitter serotonin, 90% is produced in our gut. So it's known as the second brain. So it's always important to start healing our gut first, and then you address elsewhere.
When you talk about guts, right? How do you prevent this guts problem? Is it from what you eat, or is it from environment? What is it?
So
Because I feel that I eat well. I mean, I watch out for whatever I eat, but I still might have some guts problem, as you say. And you only realize you have guts problem when you feel not well. And by the time you realize, it's quite late already. I mean, you need to do quite a bit of treatment.
You see, the thing is about gut, we all actually have clinical symptoms. Like sometimes, you feel very bloated after eating. So that is already like one sign. And then, we have heartburn, which is reflux. So it's already telling you that, hey,
Reflux.
let's look into our gut health. What's happening?
What if the symptoms comes and go? Like I feel good today and the next day I feel good. I mean, I feel bad today, but I don't feel, things like that. I mean, it can be like not all the time kind of symptom.
Yeah. But somehow we'll be able to identify, because, I think sometimes, when you feel not so good, you just have to think back, what did you eat? What did you have?
Yeah, we always think that way.
Yes. And then, you can just note it, put it in your diary. This is what I had today.
So you need to put
my breakfast, my lunch, my dinner, and then, day two, and then try to look back and see what is it? What is that one factor? But hey, today, we have a lot of, we have, this food intolerance test. We can even do that, right? But, we can start from, we talk about the elimination diet. Let's look into, what you eat. What are the things? What's the common denominator? Which one we need to eliminate? See how you feel when you eliminate. So it's going back into go within and just, always listen to your body. It's always telling you something. You just need to heed it.
Yeah. The inflammation is, I was told, inflammation is a root cause of most illnesses. Is there certain things that you can include in your diet to reduce inflammation generally, like every day, to make sure you take like maybe fish, certain kinds of fruits to reduce the general inflammation level that, the body would probably face, because every day you go through life, you stop at the traffic light and someone runs the red light, and you get stressed and things like that. So that's all causes inflammation, doesn't it? Because of stress levels, things like that.
Inadequate sleep. So I think, that's not one factor that will help to reduce that. But again, you mentioned, you talk about the diet, is eating healthy, right? So for example, when you talk about eating healthy, you got to avoid the sugar, right? Because sugar causes inflammation. And then when you talk about, try to get as much of antioxidants in your diet, make your diet as colorful as possible, right? When you talk about the vegetables,
colorful fruits as well.
Yes, but but be mindful that certain fruits, it's high in glycemic index, high sugar. So go for the one that is not on that part, So when you talk about high sugar, you're talking grapes, watermelon, all those ripe mangoes where we all love because it's got natural sweetness.
And taking it at the certain time, I guess. You can take mango, but probably in the morning, but not in the evening.
Yeah. All those.
So we can't stop, completely, eating mango, because I love mango as well.
Yes, I do too. So it's, it's basically looking into the diet again and looking into like certain supplements where your body requires, where you're not getting adequate optimum from your diet. You know, because some of them, they'll tell me like, doc, I eat healthy. But if you talk about analogy, to get 1 gram of vitamin C is equivalent to about 13 to 15 oranges per day. So do you consume that amount of oranges per day? It's just an analogy, something for you all to think about.
Interesting.
Yeah. We have to see Dr. Sangeet. We do to relook our diets. To make sure I have enough vitamin C because I do like my sugars.
Oh, I think we also did look at like my but you know, look, we are Malaysians, we are foodies.
We are so enjoys us, you know.
Yeah, so I would generally say, look, you know what? Don't go so hard on yourself. Out of 7 days, 5 days eat healthy,
And 1 day cheat day, but moderately.
moderate. Everything is about moderation. It's all about moderation, you know, check and balance. And yeah, we love our food. We are Malaysians. So I think whatever goals that we have, we got to be tangible. Don't be too hard, but at the same time. So for me, it's like, you know, I actually, people will say we eat to live, but I literally live to eat. So I make sure that, you know, it's like, whether it's exercise, it's hitting the gym, it's doing my yoga, you know, I address all that. So I get to enjoy my food.
Sure.
Yeah. I have my cheat days too. And I have my cravings as well, but in moderation. Yeah.
Recently learned so much today about hormones, about nutrition, and how everything just falls into one basket where you have to make sure that your life is conducted properly. Basically, that you eat the right food, don't be too stressed, and to maintain a good hormone level, to be happy, to be strong, and to generally to live a longer life.
It's a holistic, right? It's a holistic concept. Yes.
Yeah.
Yes.
Very insightful sharing indeed. Thank you so much for being with us today.
My pleasure. And thank you so much for having me with Sarina and Fasila. Thanks to you too. Thank you.